we start, I would like to ask your help to hit the like button, hit the subscribe, and smash the bell. Smash like hawk. Hey, welcome back. This is Dr. Low, Gynae Penang. Today I'm going to talk about booster dose. Alright, so I'm talking about this top 5 question about booster dose. First of all, you guys must be wondering why is this drinks here, okay, alright. I'll get to it later, alright. First question, what is a booster dose? Actually, booster dose is just like third dose, where we first and second dose is the basic dose, and then the third one is to boost up your immunity. That's why it's called booster dose. Alright. So for example, your first dose, let's say this is an AZ vaccine, this is a Pfizer vaccine, and this is a Sinovac vaccine. That's why the first dose that you have is let's say it's an AZ, second dose is AZ, third dose is an AZ, but 3 of this thing is actually the same vaccine. There's no vaccine written there AZ first dose, AZ second dose, AZ booster. It's just the same vaccine, alright? And just that your timing of taken is different. First you take in the breakfast, which is the first dose, the lunch, the second dose, the third dose is the dinner, alright? And then it's the same vaccine, alright? The second question is a bit of a odd thing because everyone like to ask, doctor, is it safe to mix the vaccine? Alright. If you take your lunch, your breakfast having Milo, can you take your lunch taking the coffee? You can, right? Alright. And then if you have 2 Milo for breakfast and lunch, can you have a dinner with coffee? You can, right? Okay. When you take your dinner with coffee, does this coffee go into your body and turn into Neslo? No. Why? Because within 4 hours, your Milo already went to your bowel and maybe you already passed the feces out, alright? But not so fast, maybe it just haven't absorbed yet, alright? So anyway, it's not mixed. So it doesn't mean that when you have your dinner, you went in, everything become Neslo. Similarly, for the vaccine, when you take the first dose, second dose, let's say you take Pfizer, you take the AZ, and then after you have stimulate the immune system, it already will break down. Okay, the things, the RNA or the vector contain DNA. Actually, they are so weak that is have to be put in the fridge because it's not stable. Once into the body, the temperature difference it will just dissolve after triggering the immune system. Therefore, there is no mixing. And then, if you're worried about the danger of mixing, you can just look at your baby. When the baby came out, there's 2 vaccines. Within 1 year, maybe there's 3 or 4 or maybe up to 5 different vaccines. Are they mixing the vaccine? They are mixing the vaccine, but they are not actually mixed up. Alright? They are injected, it triggers the immune system, and the vaccine already went off. From the research, you can see that some people, they took their blood to check whether the vaccine is in their blood. Within maybe a few days or maybe up to 1 or 2 weeks, the vaccine is no more there. It's already resolved. There's no more residual. Alright? So there is no mixing. Okay, there's no any thought of mixing, but just a concept of you having first dose, second dose, and the third dose. Any dose different, they call it as mixing. Okay, but actually there's no real mixing inside your body. Okay, there's no Neslo, alright? The third question is, which is the safest vaccine? Like I said in the first question, all the vaccine is just the same vaccine, okay? So, this is something that you must understand that if the first, second dose, 3 of them, they are safe. Of course, the booster, they are safe. But which is better? As you can see, I use this for Sinovac because this Sinovac is just like water. After you drink this for breakfast, you'll be very, very fast, hungry, and you need to add up for your food. So you must go to the Pfizer or the AZ. Therefore, the effective one are the AZ and the Pfizer, and the Pfizer of course is the best and recommended. Okay, this is also mentioned in the Ministry of Health guidelines, which I will tell later. Alright, and then the fourth, which gestation of which stage of pregnancy is safe? Is safe in every gestation, but the government or you allow you all to choose that you can take it after your first 3 months or 12 to 14 weeks later. Why? Maybe because at the first 3 months you get very terrible sickness, I mean the morning sickness, everything, so maybe you can choose later on. Alright, but it is safe for this whole pregnancy gestation, and the best for pregnancy is still the Pfizer booster. Okay, and the last question will be, Doctor, when can I take the booster from the second dose of vaccine? Well, for me personally, I think after 3 to 6 months you can consider taking the booster. Why? Because if you say you are supposed to take at 6 months, the vaccine is not that something you go to mama store and you just sit there, hey doctor, hey hello mama, sorry not doctor, hello boss, na booster satu, then they'll give you the booster. Okay, booster they need to arrange. So if after you have passed your 3 months or 4 or 5 months, you can start considering taking on booster. Because if you wait until the 6th month, then once the arrangement everything comes, it might delay until you got the 9 months, and then from the 6th month to 9 months your protection will be less, and when you have less protection you have risk of infection. Alright, so the best is to follow the government recommendation. If you get the booster appointment, means that it's a verified safe for you, you must go for your booster. Alright, now I will share with you our Ministry of Health guideline. This guideline, the first guideline came out in the October 13, the second guideline on the November 13, which is the most updated, and then the poster, the nice one with the pregnant ladies by JKJAV, came out in January this year. Okay, and the guideline specifically mentioned 10 recommendation on November. The first recommendation is to vaccinate before the pregnant, or if you're pregnant, vaccinate as soon as possible. The second one, it mentioned that pregnant is a vulnerable group because your immunity will be reduced and the risk of infection is higher. That's why you need to be vaccinated as soon as possible. The third one is after you have Pfizer first 2 dose, the first Pfizer first 2 dose, and then after 6 months, you recommended to take the Pfizer booster. And if you have first 2 doses of Sinovac, your booster must be Pfizer. Okay, this is the recommendation from the Ministry of Health. Number 4 recommendation would say that the booster for AZ first and second dose, the timing and the benefit, they are not sure yet because waiting for further evidence. Number 5 is there's no recommended for 4th dose in pregnancy, which is 1 dose after the booster. Alright, and the 6th recommendation is the booster can be given or can be taken as soon as possible, but the mom can choose after 14 weeks if she wanted to. Alright, and the 7th, the side effect is same as previous dose, means that if you take this Milo for breakfast, you have some side effect, or lunch is some side effect, and the dinner or the booster is the same side effect. It won't be aggravated. Alright, it's not that it's a booster dose then it become a boost your side effect. Alright, and the number 8 will be if you have a severe side effect towards Pfizer, and then the booster you can choose to use the Sinovac. The severe side effect will be like the heart problem, heart symptoms, when you have shortness of breath and you have chest pain, then you can choose for Sinovac. And from the 9, there's no evidence that if you are breastfeeding and you are healthy and you're under 18, there's no evidence to show the benefit of booster. Because you are not the vulnerable group anymore, you are not the pregnant. But however, if you want to reduce your risk of infection, then booster dose is effective for you. And the 10 will be the mother must be fully counseled and it must have an informed decision whether to take the booster dose. Alright, so alright, and the last recommendation which I missed out in the number 7 will be the booster for a post-infected mother is not recommended. Means if you have 2 doses of either AZ, Sinovac, or Pfizer, and you are infected, maybe you don't need any booster anymore. This is the recommendation by our Ministry of Health. That's all for today. Okay, we come to the end. If you like this video, hit the like button, hit the subscribe button, and smash the bell, and then share it all away.